Hello and welcome to my presentation on smoking, COPD, and drug abuse mental illness education. Let's get started. Introduction of health issues. The health-related issues identified in the Sutter County Library area were smoking and COPD, as well as drug abuse and mental illness. Both smoking and drug abuse can have profound impacts on COPD and mental illness, so the presentation of health education on these topics is necessary in this area. Cigarette smoking is the largest preventable cause of death and kills more than 480,000 Americans annually. It is a contributing factor to COPD formation and exacerbation. The highest rates of smoking are seen in minority populations, which make up about 26.9% of Sutter County's population. Drug abuse is a serious problem in the United States and may be the cause of mental illness or may be performed to alleviate the symptoms of them. About half the people who experience a mental disorder will experience substance abuse. There is no significant difference in the rates for drug abuse among Caucasians and minority races. It is important to address these health issues to promote community health. Background and significance. When performing the windshield survey in this community, I observed community members smoking as well as homeless individuals outside the library who seemed to be suffering from either mental illness or drug abuse as they were talking to themselves. I went inside the library and spoke to two people who were leading a health education class. I also interviewed the library services director. The two class participants verbalized that they were active smokers and had COPD. The library director stated that he believed that the homeless individuals outside either had recreational drug use, a mental illness, or were suffering from both because they were often loitering outside or acting out. COPD is defined as a group of chronic respiratory illnesses that affect 16 million Americans. This condition also has an impact on Sutter County residents as this is an agricultural area and pesticide use as well as pollution contribute to COPD exacerbations. This county also has a big methamphetamine problem, as evidenced by the amount of people who come into the ER of the closest hospital for drug overdoses and local news headlines regarding drug busts. Healthy People 2020 objectives. Some of the objectives of Healthy People 2020 are to promote respiratory health through better prevention, detection, treatment, and education efforts, reduce substance abuse to protect health, safety, and quality of life for all, especially children, and improve mental health through prevention and by assuring access to appropriate quality mental health services. The health intervention classes meet the education aspect of these objectives as they provide participants with knowledge about how smoking affects COPD and how drug abuse is linked to mental illness. This will work to improve community health and safety. Needs assessment. In order to determine the needs of the community surrounding the Sutter County Library, I performed the windshield survey and talked to the two class participants regarding what they believed this community needed. I also interviewed the library services director on what he observed as the needs in this area. From my observation of people smoking near the library, I knew that a smoking information and suggestion class would be necessary. When the class participants stated that they had COPD and were active smokers, I got the idea to hold a smoking education class with an emphasis on its effects on COPD. I also observed homeless individuals outside the library talking to themselves, which helped me identify the need for health education and mental illness, as well as possible drug use. The library regularly holds health education classes once a week, but from looking at the topics listed, smoking, COPD, drug abuse, and mental illness have not been covered in at least 4 months. Being made aware from research that Sutter County has a methamphetamine drug abuse problem as well as issues with smoking, I established that regular health education classes that focus on these and the health complications they lead to will help community residents become more aware of the harm of these practices. This community also needs health screening services and care for COPD and mental illnesses, as well as rehab services for smoking and drug addictions. From research, I have found that healthcare clinics and rehab centers do exist in the city that provide these services with transit bus routes to these locations. Theoretical framework and needs assessment. The Proceed model is a planning tool used to design and evaluate interventions for a desired impact. The Proceed component involves assessing social, epidemiological, behavioral, environmental, educational, and ecological factors that inform the development of an intervention with underlying social cognitive theory assumptions. The Proceed component consists of pilot testing and evaluating the implementation of the strategy and population outcomes. This model guided this project in that it allowed me to identify a community that would benefit from health education-based interventions. I was able to identify a need for smoking and COPD education, as well as drug abuse and mental illness teaching through a windshield survey and research. I identified predisposing factors that could contribute to the prevalence of these problems from this model, a lack of knowledge on the effects of these habits on the health, as well as the belief that there is no real harm in these activities exist in this community. And then enabling factors, identified include smoking and drug abuse not being perceived as high priority problems in this community by the local government, as well as inadequate healthcare centers that provide health information located directly in the community. Intervention planning was part of this model, which helped me identify the content I wanted to include in the health education classes, as well as the objectives and goals I wanted to meet. This model finally allowed me to identify expected outcomes and the impact these interventions would have on the community in the future. Issues. Assets that exist in this low-income community include positive social interactions seen among community members, as well as the presence of the public library that can be used to hold regular smoking and COPD, as well as drug abuse and mental illness classes that are open to everyone. Barriers include a lack of health service centers that are located in the community that can also provide health promotion education. There is also a limited funding for health education interventions from the local government, which make it difficult to plan health fairs and fund health education ventures. A change in the mindset of community members needs to occur so that they realize the health risks of smoking with COPD and drug abuse while suffering from mental illness. Education needs to be provided about these topics in high schools, at doctor's office appointments, and at health fair ventures. Education that includes statistics of the number of people suffering from these conditions may prove effective. These will all work to reduce the number of people that partake in these adverse behaviors, suffer from chronic conditions, and are hospitalized due to exacerbations. Interventions. According to Healthy People 2020, some of the major health promotion goals are to promote respiratory health through better prevention, detection, and education efforts, reduce substance abuse to protect health and safety and quality of life, as well as improve mental health through prevention and ensuring access to appropriate mental health services. The health teaching interventions I held satisfy the education component of these objectives. On November 30th, I held my smoking and COPD class at the Sutter County Library conference room. I had 10 class attendants and began the class by introducing myself and the topic I was covering. I used a PowerPoint presentation to guide my explanation on cigarette smoke and its ingredients, the health impact of smoking, the effect smoking has on COPD, how to improve COPD by altering smoking habits, and smoking cessation information. I then summarized the presented information and asked the class participants questions as a form of teachback, and then had a Q&A session that was 10 minutes long. On December the 7th, I held my drug abuse and mental illness class in the same conference room as the one where I held the smoking and COPD class. The format of this class was similar to that of the previous one. There were 8 attendants, and I began the session by introducing myself and explaining the topic. I then used the presentation to guide the teaching session. I explained what drug abuse was, types of mental illnesses, how drug abuse and other factors affect mental illness, and available community resources that offer drug abuse rehab. I then summarized this information and had the class teach back this content by asking them questions. And finally, there was also another 10-minute Q&A session. I gave them a handout with the main points of the presentation on them, and the information from both classes was well received, and the class participants were attentive and respectful. Budget. In terms of funds for regular health education classes that would cover topics such as smoking, COPD, and drug abuse mental illness, or community knowledge promotion at the library, there would be no additional cost. The library already has weekly health educational classes that are taught by volunteer healthcare professionals. The library owns all the equipment needed, such as a projector and a conference room. The speaker just needs a personal computer for the presentation and to print flyers advertising the class content, which would cost about $10 to $15. In order to hold health fairs, more costs will be involved to obtain tables and chairs, printed informative material, and screening tools such as blood pressure cuffs. This would cost about $400 to $600. There would be no need for salaries, as volunteer healthcare professionals such as doctors, nurses, and even nursing students can run the fair. In order to establish an in-community health center, great funds and resources would be required. There's a need for building, materials such as chairs and examination tables, utilities, and employed healthcare professionals. Organizational training would also be necessary for the personnel. This is a costly and time-consuming venture, but it would help to improve community health and potentially decrease the number of people smoking with COPD and using drugs with mental illnesses. The cost of this would be thousands to millions of dollars, and the current budget would not cover this project. There would be needs for additional funding as well as a larger budget. Project evaluation outcome measurement. When creating and performing the health education interventions, the following were my short-term objectives. By the end of the smoking and COPD class, at least 3 of the attendees will be able to list 2 of the main ingredients in cigarettes. By the end of the smoking and COPD class, 5 of the attendees will be able to simply explain how smoking can cause COPD. By the end of the substance abuse and mental illness class, 70% of the attendees will be able to see 3 of the negative effects on health of recreational drug use. And by the end of the substance abuse and mental illness class, 5 of the attendees will be able to explain the impact drug use has on mental illness. My long-term objectives were there will be less people seen smoking cigarettes around the Sutter County Library area, and there'll be less people seen acting out for mental illness or potential drug abuse. The short-term goals that I established were successful. The class attendees were able to answer my questions and teach back the provided information to me. This was determined during the end of the class summary as well as the Q&A session. The long-term goals are yet to be evaluated in another windshield survey in 1 month's time. This would be a good evaluation tool to determine if the objectives are being met. Another interview with the library services director would also help to identify if there have been any changes in community practices, since the library services director is there every weekday, so he can adequately observe. Regular monthly classes that present smoking and COPD, as well as drug abuse and mental illness education, can help to ensure that there is continued progress towards these long-term goals that will benefit the community's health. Results and conclusions. To summarize this presentation, 2 community-based health education interventions were performed on the low-income communities surrounding Sutter County Library. This intervention satisfied the education component of the Healthy People 2020 goals to promote respiratory health through better prevention and education, reduce substance abuse to protect health and safety, as well as improve mental health through prevention and education, and ensure that there is appropriate access to quality mental health services. One of the proposed interventions to aid in meeting the objectives would be to have regular health education classes with topics based on community health needs, such as COPD or mental illness. This costs next to nothing and would be beneficial in promoting community health. The short-term goals from the health education class were met during the end of class summary and the Q&A sessions. It is still to be determined whether the long-term goals will be met through another windshield survey and an interview with the library services director. The strengths I experienced with this project were the ease with which I could travel to the low-income area to perform the windshield survey, the approachability of the class of participants to ask them questions, and the helpful nature of the library services director. The weaknesses and problems experienced were time constraints and schedule clashes with other health education classes at the library. Since I was a guest presenter, I had to move my scheduled classes to accommodate the current scheduled health education classes. If I were to do this population level project again, I would contact the key stakeholder of the community, which is the library services director, earlier than I did, as I believe this would have avoided the class schedule clashes. I would also talk to more community members than just the 2 class participants and the library director, as this would help me ensure that I am more accurately assessing the needs of the community and my interventions and goals are aligned with the most pressing issues in this community. These are my references. And thank you for listening to this presentation.